Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, thank you so much for joining us.
Thank you very much for having me on the program.
Yes, sir. A lot has transpired in the past few days. First of all, we got some vaccines that the public was unaware of from Barbados. And then today, the frontline workers were given the first dose. Just tell us a little bit about that.
Well, we are quite excited. We received 3,000 doses of the AstraZeneca vaccine as a donation from the government of Barbados. And they in turn had received this as a donation from the government of India. With the doses that we have received, we've started a program of immunizing our frontline health workers. So this morning we were at the Georgetown Public Hospital, where a number of doctors and other allied health workers at the hospital received their first doses of vaccines. And then we went also to the Ocean View facility, where the doctors and nurses and other health personnel who were working at Ocean View was able to get their first vaccine today. So it's an exciting time because we all know that once you get a vaccine, you get a first dose, that it starts helping your immune system to protect you from COVID. And when you get the second dose, that immunity is further boosted. So it's a good thing.
All right. I know you've said it over and over again that nobody would be forced to take the vaccine, and you've gone extensively into education as to why it should be taken and so on. What has been the response like from the frontline workers?
Well, initially we were catering for, not a lot of people coming out, but our system quickly got overwhelmed. So as maybe about 2 hours ago, we've already completed about 150 persons. And so the response has been tremendous. And I'm extremely pleased that a number of the senior doctors who understand the importance of this has also come forward and taken the vaccine. We have the Director of Medical Services at the GPHC, Dr. Fawcett Jeffrey. He took his shot this morning. We had Dr. Boville, who runs the Ocean View facility. She took her shot this morning as well. Both of them, they took their vaccines at the Ocean View facility, along with a lot of the medical staff there. And at the Georgetown Public Hospital, apart from the pharmacist who was the first person in Guyana, that's historic, to be able to get that vaccine, we had other senior doctors there, Dr. Mahendra Karpen, who heads the internal disease department of the GPHC. We had Dr. Zulfikar Box, who is the head of the accident and emergency and the EMS services at the hospital. We had Dr. Harvey, who heads anesthesiology at the Georgetown Public Hospital. We had Dr. Sipasad, who heads pediatrics. So we had very senior doctors who came out. And of course, there are many others who have joined the team in getting their vaccine. And I think that's good because now people understand the importance of vaccines. And I just want to assure everyone that we are getting in more vaccine. This is just the start. And we are going to have more doses so that every health worker would be able to get a vaccine. We'll get many more doses by the end of the month, and by the first week in March, we'll have enough doses for everybody. So whether you're in the private sector or in the public sector, we will be giving you these vaccines once you would like to get it. We also would be collaborating with the private sector to ensure that we can develop some sites at their facilities. So I think this is all good. It's all exciting news. And it's perhaps a very historic day because this would mark the beginning of the end of the pandemic in Guyana, because we know that vaccines is one of the safest way of exiting this pandemic. And once we get enough people to take the vaccine, then we can achieve herd immunity which would then mean that we can open up, you know, for business and do other things. But for now, even those who have had the vaccine, they still have to abide by the rules, still have to wear their mask, and they still have to do all the other things that we have been emphasizing.
All right. Two quick follow-up questions. In terms of the medical team that goes into the region and stuff, are any specific measures in place for them with being vaccinated?
Yes, we would be able to give to the rapid deployment teams their vaccines as well.
All right. And my second question as relates to the vaccine, you have indicated that you would take the vaccine when the time comes. While I would call you a medical worker because you're the chief among us, I know you would say otherwise. But as I said, you're in line to take yours as well.
Well, yes, but what we prefer to do, because there are persons who interact with patients on a daily basis, and we think that they're the first people to be able to get this vaccine because their risk is much higher than mine. I'm not in the hospital every day, so we'll prefer that those persons who are at increased risk, that they get the vaccines first, and then later on, as we get more vaccines, we'll take the shot.
All right, thank you, sir. Well, from one set of good news to another, I believe that we've received the results of those tests that went to CARFA. Could you tell us about that?
Yes, last night, CARFA informed us that the 10 samples that we sent to them, that they've been able to complete the gene sequencing, and they haven't found any of the new variants that are currently talked about. That is the variant first discovered in the UK, the one in South Africa, and the one next door.
Yeah.
So in a way, that's good news, but that does not mean that we have to decrease our vigilance, because we'll still have to continue taking samples, sending them out, just to get a sense of what is circulating here in Guyana.
Okay. I just wanted to ask you a question outside of COVID-19. Last October, when you visited Region 6, you were talking a lot about the ophthalmology hospital and getting it restarted. Well, we've got news that 16 patients successfully did their cataract surgeries at Port Morant. Could you tell us about that?
Well, some of the measures after that visit, because we recognized that the place was not working, the types of surgery that we were accustomed to be done there was not happening. And generally, we were totally displeased with what we found there. So one of the things that I did was to appoint Dr. Shailendra Sugrim as the national coordinator for eye diseases in Guyana. And in that role, he then assumes oversight over all of our ophthalmology facility, including the Port Morant Hospital. And so he and a team went up subsequently. They did some assessments, and then over the last week or so, they were able to go back and initiate surgeries there. So they did, I think, 15 or 16 cataract surgery, and they were able to do the surgery because a team went from Georgetown Public Hospital, and they collaborated with some of the doctors who were on site. And we intend to continue this process, and we want to make sure that we are able to get the Port Morant facility up and running. It would require that we get some additional resources to fix some of the equipment that we have there, but we are getting there slowly. But I'm extremely pleased that they have put back the place to use, and that we have started the first set of surgeries after a long time. There might have been a gap for more than a year. So I'm extremely pleased that we've been able to do that.
Okay, sir. As I wrap up now, I have our daily COVID-19 vaccine education question. You did indicate just now that even after the first dose, persons still have to continue practicing the safety measures. Well, this question is closely related to that. Would a person need to continue wearing a mask and avoid close contact with other persons if they've gotten the second dose as well?
The scientific community and the scientific guidance is that even after you get your vaccine, that you should continue to wear the mask, because there are several reasons. One, when you get the first dose, your body now has to start reacting to the vaccine to make the antibodies and to develop that level of antibody in your system. It takes some time. So in that period, while you develop antibodies in your system, if you're not careful, then you can get infected, right? Most of these vaccines, there's no vaccine that is 100% efficacious, and because of that, there's still a chance that you can get infected. What, however, all of these vaccines that are currently in use have been, they have been demonstrated to do is that if you get infected, then you're not going to get the severe form of the infection, meaning that you can avoid hospitalization, you can avoid getting into the ICU. And in all of the clinical trials, what they've found is that once people get vaccinated, their chances of being hospitalized is less, their chances of being in the ICU is less, and there have been no cases of deaths once you have been vaccinated, because it prevents this severe form of the infection, which is a really good thing.
All right. Well, Minister, it was a pleasure. Thank you so much for speaking with us.
But thank you very much.
Yes, sir. Well, that's it for today's COVID-19 update. We, of course, just spoke with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and, of course, our social media platforms.